Revolutionary talk for revolutionary times. Promoting peace, liberty, and prosperity around the clock. LibertyTalk.fm.
Welcome to Living the Solution with Dr. Elena George. Today we have a return guest, somebody I'm looking forward to speaking with again. She was a wealth of knowledge last time she was on the show. And since that time, I've become a lot more cognizant of EMF and 5G and all the things that we surround ourselves with. I'm actually seeing patients in my practice, and it's been really interesting to educate them and see the difference. And we're going to speak with Miss Cathy Cooke. She's been working as an integrative health coach since 2014. She's a board certified holistic nutritionist with the National Association of Nutritional Professionals, as well as one of the sector's most knowledgeable people on the subject of building biology. And, you know, Ms. Cooke, first of all, I want to thank you for taking the time to come back on the show. But since you were last on, I've really become a lot more aware, and I've taken personal steps towards protecting my health. And I've been able to be actually a sounding board and a wealth of knowledge for my patients. So thank you, because you gave me tools I didn't even know that I could use.
Well, that's great. Well, first of all, yeah, thank you for having me back. It's always a pleasure to speak with you and share this information. And that makes me just beyond happy to hear that you are becoming more knowledgeable in the area and using this in your practice. I mean, that's, what having these conversations is all about. So I'm really happy to hear that.
Well, good. I think we can take our next step forward, because this is something that affects everybody. I don't think I can't name anybody who's not affected in some way by it. People who work from home or on their computers all the time, office buildings who've like rewired, all sorts of things. And I've had patients with mold toxicity, and just clearing their environment from all of the wireless products and wireless toxins, I guess I can put it, they've really improved. So let's start from the beginning. How did you come to this? This is a very unique space, one that it's extremely important to understand.
Yeah, well, like many people, I was having my own health challenges. And I had decades of just, these mysterious chronic symptoms that, of course, nobody could figure out. And it was about 2014, 2015 that I started to pay attention to the possibility of EMF and the environment in general, and questioning whether that could be a factor in my symptoms. And sure enough, when I did a little test by putting my phone in a drawer for a week and turning off my Wi-Fi, committing to not having any radio frequency for a week, I felt dramatically better within 2 days. And I saw a plethora of my symptoms clear up, including tinnitus, or severe ringing in my ear for that I had for 10 years, and it was literally gone in 2 days after not using a phone. My sleep dramatically improved. My anxiety cleared up. My energy was better. It was just so profound that I could not ignore it. And, to make a long story short, I just dove in and said, if I'm going to, continue to get better and help my clients with their health, because I was practicing as a nutritionist at the time, that I have to know the environmental piece of it. And so then I enrolled with the Building Biology Institute in 2017, and I've been practicing ever since.
Well, I want to confirm and give another example of what you just described. I had a patient with tinnitus, and she was the side where the ringing was on was the side that she kept her phone at her bedside table. And I asked her to just turn that thing off, turn her router off. And I mean, came in pretty much really just anxiety ridden. And it was just such an awesome return visit when she said it's gone. I was like amazed. She was amazed. And it's something I ask all of my patients now. That's how important I feel that it is. Now, you're a nutritionist, so you really understand cellular biology and how the body works. I think you have a leg up when it comes to that compared to most physicians who we barely get taught that. What are some of the things that you find overall, is there something in our diets or the way we what we choose to eat that makes us more sensitive to EMF?
Well, that's a great question. You know, it actually goes a little deeper than diet when we're talking about what we would call precursors to why somebody may feel the electromagnetic fields more than someone else. And diet can play a role in the precursors, but the main ones that I see are fairly significant events in someone's life. So a trauma, that could be a physical trauma like a bump to the head, or concussions, brain traumas, TBIs. They certainly can cause someone to be sensitive. In fact, I know many people that have had just that, a literal bump to the head, and then overnight they became very, very sensitive. It could be an emotional trauma. So we all have emotional traumas and adverse childhood events that can cause us to become sensitive. It could be an infection like Lyme disease, SIBO, small intestinal bacterial overgrowth, or other kind of, viral, bacterial, parasitic infection. It could be an extreme exposure to EMF. Say you're a lineman or someone that's working in IT and you have exponentially higher exposures or a very high acute exposure to EMF. I even have a colleague who was struck by lightning and then he became highly sensitive. Um, let's see. There, of course, you mentioned mold. That is a huge precursor. I would say my most severely sensitive clients have had a mold exposure, a pretty dramatic mold exposure, and then they become sensitive after that. There's also chemical exposures. I have one client that used to own a carpet company, and he was invariably exposed to countless toxic chemicals from his profession, and then he became sensitive. So diet can play a role there, because if we are not eating to support our gut health, our inflammation, our brain health, our infections, all of these things, our sensitivities are going to only increase, given that we have these exposures. And then there's also the oxidative stress piece. If we're talking only to diet alone, we know that EMF affects us on a cellular level by causing oxidative stress. And so specifically what it does is it artificially opens our voltage gated calcium channels, which can allow a flood of calcium ions into the cell, which we don't actually want. We only want a little bit of calcium on the inside. When we get too much, we get this downstream effect of oxidative stress. So if we're not combating that with a diet rich in antioxidants, and minerals as well, specifically magnesium, then we're not combating the invariable exposure that most of us get on a daily basis. So that's kind of a long-winded answer to your question, as it's multifactorial, but all of these factors play a really important role.
I think that was an excellent answer, not long-winded at all. And it's so complex, but it all comes down to energy and voltage. And I think I'm learning a lot more about how the cellular health, viability, longevity, all depends on how much energy it's able to harness, maintain. And I have a question about whether this is like supercharging it and making it become overreactive. But let me let you answer that when we come back from the break. So let's